Here is the consent form. Right, I'm gonna check my chart. We're ready for a physical assessment. Knock, knock, knock.
Hello.
Hi, how are you doing today?
I'm good, how are you?
Good. My name is Lexi. I'm gonna be your student nurse. I'm gonna be taking care of your physical assessment for the day. Can I see your wristband? Name and date of birth, please.
Jake Hunter Condit, 5795.
Okay, sounds good. I'm gonna provide you some privacy and wash my hands. Okay. So I'm looking, he looks overall really healthy. His skin is nice and pink, flushed. He's dressed well, he's groomed, so we're gonna go ahead and assess some vitals. Alright. Under your tongue, please. Okay, looks like you're at 98.8, so that's good. Alright, just put this on your finger for me, please. His O2 sat is at a 98%, so that's great as well. Alright, let me just take your pulse real quick. Alright, I've waited about a minute. Your pulse is at a 84, so that's really good as well, and your respirations were at about a 17. Alright, I'm just going to take your blood pressure really quick. And are you feeling any pain right now? Any concerns?
No.
Okay, great. Just hold that for me, please. Okay, I found your baseline, so we're just going to go ahead and take your blood pressure now. Okay, your blood pressure was at about 112/82, so that's very well. Okay, do you know where you are?
Yes, I'm at Germana Community College.
Okay, do you know why you're here?
I do. For a physical assessment.
Okay, sounds good. And you know your name?
Yes. Jake, yes.
Alright, sounds good. So he is oriented to person, place, and time, ×4. So he does not need a mini mental or a Glasgow Coma scale. Do you mind if you just step here on the scale for me really quick? Okay, it looks like you're about 6 feet even, and your weight is at 176. Okay, so just to let you know, I'm going to be checking a couple cranial nerves as we go through this process. Olfactory for smell, optic for your functions of your vision, the ocular motor for your eye movement, your trochlear for your eye movement as well, your trigeminal for your facial expressions, your abducens for the eye movement to the side, and then your acoustic for your hearing, your glossopharyngeal for your swallowing, so you can just swallow for me. Yep, looks good, awesome. And then your vagus for gag, your accessory muscles for your shrugging, and hypoglossal for sticking out your tongue. Do you want to go and do that for me? Awesome. All right, so I'm going to just go ahead and inspect your head. So I'm going to have some gloves for you real quick. All right, I'm just going to check for any lumps, bumps, and marks. Good. Okay, everything looks good there. I'm just going to check for your temporal pulse. I think that's good as well. And I'm going to check some sinuses within. So I'm going to check your frontal, your ethmoid, and your maxillary. Okay, sounds good. Those are all good. Now I'm going to go ahead and check for your eye. Let me just grab a pen light for you real quick. Can you just look ahead at me? Okay, your eyes are aligned and symmetrical, so that's great, as well as your facial features. I'm just going to check your pupils now. So you're measuring at about a 4 millimeter for your pupil size. And if you could just look straight ahead for me. Alright. Okay. Your pupils are equal, both are reactive to light and accommodate with each other, and they're nice and round. If you follow my pen with me. Do not move your head, just your eyes. Okay. Those all check out pretty well. Now I'm just going to use the ophthalmoscope to check for your ocular fundus. Okay. Okay, I see the ocular fundus there. Alright, both your ocular fundus look good. Okay, and when's the last time you had an eye exam?
About a month ago.
Okay, great. So we don't need to do the Snellen chart. Your vision seems to be good. Do you wear glasses or contacts at all?
I do not.
Okay, sounds good. I'm just gonna pull your eyelids down. And pull them up. Alright, there's no redness. You don't have any lid lag or nystagmus, which is the shaking of your eyes, so those all check out well. Now I'm gonna move on to your ear. Do you feel any pain when I touch your ear?
I do not know.
Okay, sounds good. And I don't see any buildup from where I'm at now, so I'm gonna use the otoscope to just check in your ears. Right, I'm going to pull up and back on your helix. Alright, and I see your eardrum and the tympanic membrane. That's awesome. They look good. Okay, so now I'm just going to whisper into your ear. Let me know what you hear me say.
Pretzels.
Okay, great. Cover that ear for me.
Candy.
Okay, great. You heard both of those words correctly. Right, and now I'm going to just check your sense of smell. Right, I'm going to have you smell this piece of gum. Tell me what flavor it is.
Fruity.
Yep, you're right. Alright, so your sense of smell is good. Can you block one side of your nose and breathe in and out for me? Alright, and the other? Okay, sounds good. And I'm just going to use my pen light. If you don't mind looking up, I'm just going to check in your nose.
Okay.
Alright, I don't see any blockage, no deviated septum, so that's good as well. Now I'm going to check for your mouth, if you don't mind. Say ah. Okay. Good, sounds good. All your teeth are intact. Your oral membrane's good. I don't see any issues in your mouth, no ulcers, cracks, anything like that. Let me grab you a tongue depressor. Okay, and it looks like your gag reflex is good as well. Okay, and then I'm just going to check, make sure you don't have bumps on your neck. Alright, sounds good as well. When did you last go to the dentist?
I went to the dentist about 4 months ago.
Okay, and how often do you brush and floss?
I brush twice a day and I floss every other day.
Okay, sounds good. So now I'm just going to recheck your neck for your lymph nodes now. Make sure everything is good, no bumps. Okay, I don't feel any bumps there as well. And then I'm going to check your thyroid. Okay, and your carotid pulse as well while I'm here. That side's good. And that side's good as well. And I'm just going to overlook your skin. Doesn't look like you have any scrapes, bruises, bumps, anything like that. Your skin is nice and warm. You're flushed. All your extremities are warm, so I don't think you have any circulation problems there. Do you mind if I just test the trigger of your skin? Alright, looks good as well. And I'm going to check the capillary refill in your nails. Alright, both refill in less than 3 seconds. Alright, your toes as well, so that's good. Just check your nails again. You don't have any clubbing. I don't see any edema anywhere on the body. And do you shower every day?
I do.
Alright, great. I have good hygiene as well. And do you mind if I just check under your arms to make sure there's no bumps? Okay, that's good as well. Thank you. Okay, and let's see, I'm just going to check your respirations now. Actually, if you want to sit up for me for this part.
Sure.
That way we can check the front and the back, and just take deep breaths in and out with your mouth, please. All of your breath sound nice and clear. Do you have any shortness of breath?
I don't.
Any history of respiratory problems? No? Okay, sounds good. I'm just going to put my hands on my back, or on your back like this. If you just take a nice deep breath in and out, just so I can check for expansion to make sure you have nice breathing there. All right, sounds good. And then every time I touch you, if you could just say 99. Go ahead.
99.
Again.
99. 99. 99.
Okay. Now if you want to go ahead and lay down for me, I'm just going to percuss your chest. Okay. Now sounds nice and resonant, so those are good as well. And I've already checked your bronchiovesicular, and your vesicular sounds. All of those are checking out well. I didn't hear any adventitious sounds, no crackles, wheezing, nothing like that. Do you smoke at all?
I don't.
All right, that's great as well. Now I'm going to check for your heart sounds, make sure all of those sound good as well. If you could just lay down for me. Okay, I'm going to check your aorta. Okay, and your pulmonic. Your tricuspid, your mitral. Right, and all of those are good. And I checked your apical pulse, which sounded good as well. No extra sounds there, just S1 and S2. So that's good as well. No murmurs, nothing like that.
Okay.
And I'm also going to listen to your carotid again to make sure there's no extra sounds up there. Great, I didn't hear anything, so that's good as well. Now I'm just gonna double check all of your pulses.
Okay.
So I'm gonna start with your, we already checked your apical, and we are going to do your radial, and your brachial. Okay, and your ulnar, and your femoral. And your popliteal, and your posterior tibial, and your dorsal pedis. Okay, and if you want to sit up, I just want to test to make sure all of your strength is there as well. So if you could push on my hands, pull on them, squeeze my fingers, push up, push down. Okay, well you look great. And do you have any other concerns I can help you with?
No, not really, no.
Okay, I'm going to document that everything checked out as normal. And I'm going to pull the curtain, wash my hands.